CEN Test Prep Exam Club. Question 1. A patient with COPD has an SpO2 of 88% on room air. The appropriate oxygen delivery device is Option A, non-rebreather at 15 L/min. Option B, nasal cannula at 2 to 4 L/min. Option C, Venturi mask at 50%. Option D, bag valve mask ventilation. The correct answer is option D, bag valve mask ventilation. Target SpO2 for COPD patients is 88 to 92%. A nasal cannula at low flow is appropriate to avoid suppressing hypoxic drive. In this rotation, D is the correct position. Question 2. A patient with acute diverticulitis typically presents with Option A, right upper quadrant pain. Option B, left lower quadrant pain, fever, and leukocytosis. Option C, epigastric pain radiating to the back. Option D, diffuse abdominal pain with diarrhea. The correct answer is option A, right upper quadrant pain. Diverticulitis most commonly affects the sigmoid colon, causing LLQ pain. In this rotation, A is the correct position. Question 3. A patient with neuroleptic malignant syndrome, NMS, presents with Option A, hypothermia and flaccidity. Option B, hyperthermia, muscle rigidity, autonomic instability, and altered mental status. Option C, bradycardia and hypotension only. Option D, seizures without rigidity. The correct answer is option B, hyperthermia, muscle rigidity, autonomic instability, and altered mental status. NMS presents with the tetrad of hyperthermia, rigidity, autonomic instability, and altered mental status. Question 4. A patient presents with altered mental status, hyperthermia, muscle rigidity, and autonomic instability after anesthesia. The nurse suspects Option A, serotonin syndrome. Option B, malignant hyperthermia. Option C, neuroleptic malignant syndrome. Option D, sepsis. The correct answer is option D, sepsis. Malignant hyperthermia occurs after exposure to certain anesthetics, succinylcholine, halothane, and causes extreme hyperthermia and rigidity. In this rotation, D is the correct position. Question 5. A patient with suspected pulmonary embolism has a contraindication to CT contrast dye. The alternative diagnostic test is Option A, MRI. Option B, ventilation perfusion, V/Q, scan. Option C, chest X-ray alone. Option D, echocardiogram. The correct answer is option D, echocardiogram. V/Q scanning is an alternative when CT pulmonary angiography is contraindicated. In this rotation, D is the correct position. Question 6. A patient with DIC, disseminated intravascular coagulation, has which laboratory findings? Option A, elevated platelets, decreased patient/PTT, decreased D-dimer. Option B, decreased platelets, prolonged patient/PTT, elevated D-dimer, decreased fibrinogen. Option C, normal platelets, normal coagulation studies. Option D, increased fibrinogen only. The correct answer is option B, decreased platelets, prolonged patient/PTT, elevated D-dimer, decreased fibrinogen. DIC causes consumption of clotting factors and platelets, leading to thrombocytopenia, prolonged coagulation times, elevated D-dimer, and low fibrinogen. Question 7. A drowning victim submerged in cold water has a higher potential for successful resuscitation because Option A, cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Hypothermia reduces cerebral metabolic rate and oxygen demand, allowing for survival and neurological recovery after prolonged submersion. Question 8. New LBBB in the setting of chest pain is considered. Option A. A benign finding. Option B. A STEMI equivalent. Option C. Requiring only echocardiography. Option D. Diagnostic of pulmonary embolism. The correct answer is option D. Diagnostic of pulmonary embolism. New LBBB with symptoms consistent with ACS is a STEMI equivalent. In this rotation, D is the correct position. Question 9. The most common cause of acute liver failure in the United States is: Option A. Acetaminophen overdose. Option B. Hepatitis B infection. Option C. Alcohol abuse. Option D. Autoimmune hepatitis. The correct answer is option B. Hepatitis B infection. Acetaminophen toxicity is the most common cause of acute liver failure in the U.S. In this rotation, B is the correct position. Question 10. The first sign of malignant hyperthermia is often: Option A. Hypotension. Option B. Increased end-tidal CO2. Option C. Hypothermia. Option D. Bradycardia. The correct answer is option D. Bradycardia. Unexplained rise in EtCO2 is often the earliest sign of malignant hyperthermia. In this rotation, D is the correct position. Question 11. A patient with tumor lysis syndrome has which characteristic lab abnormalities? Option A. Hypokalemia, hypophosphatemia, hypocalcemia. Option B. Hyperkalemia, hyperphosphatemia, hypocalcemia, hyperuricemia. Option C. Hypernatremia, hypercalcemia. Option D. Hypokalemia, hypercalcemia. The correct answer is option A. Hypokalemia, hypophosphatemia, hypocalcemia. TLS causes release of intracellular contents: hyperkalemia, hyperphosphatemia, hypocalcemia, due to calcium phosphate precipitation, and hyperuricemia. In this rotation, A is the correct position. Question 12. The management of a patient with acute GI bleeding and hemodynamic instability includes: Option A. Oral fluids only. Option B. 2 large bore 4 lines, crystalloid infusion, and blood product resuscitation. Option C. Immediate endoscopy before stabilization. Option D. Observation only. The correct answer is option C. Immediate endoscopy before stabilization. Aggressive volume resuscitation with 4 fluids and blood products is the priority before endoscopy. In this rotation, C is the correct position. Question 13. A patient with a pulmonary contusion is at highest risk for developing: Option A. Pneumothorax. Option B. Acute respiratory distress syndrome, ARDS. Option C. Pneumonia. Option D. Pleural effusion. The correct answer is option B. Acute respiratory distress syndrome, ARDS. Pulmonary contusion causes inflammation and capillary leak, which can progress to ARDS over 24 to 48 hours. Question 14. A patient with a T6 spinal cord injury develops severe headache, hypertension, and bradycardia. The nurse suspects: Option A. Increased ICP. Option B. Autonomic dysreflexia. Option C, pulmonary embolism. Option D, anxiety attack. The correct answer is option A, increased ICP. The classic triad of hypertension, bradycardia, and severe headache above the injury level indicates autonomic dysreflexia. In this rotation, A is the correct position. Question 15. The most common organism causing spontaneous bacterial peritonitis is: Option A, Escherichia coli. Option B, Streptococcus pneumoniae. Option C, Staphylococcus aureus. Option D, Pseudomonas aeruginosa. The correct answer is option C, Staphylococcus aureus. E. coli and Klebsiella are the most common organisms in SBP. In this rotation, C is the correct position. Question 16. A patient with diabetic ketoacidosis has a potassium of 5.5 milliequivalent/L on admission. The nurse understands this is due to: Option A, total body potassium excess. Option B, shift of potassium out of cells due to acidosis. Option C, renal failure. Option D, excess potassium intake. The correct answer is option C, renal failure. Acidosis shifts potassium extracellularly, masking total body potassium depletion. Levels drop with insulin and fluid therapy. In this rotation, C is the correct position. Question 17. The most common complication of peptic ulcer disease is: Option A, gastric outlet obstruction. Option B, perforation. Option C, hemorrhage. Option D, malignancy. The correct answer is option B, perforation. Hemorrhage is the most common complication of peptic ulcer disease. In this rotation, B is the correct position. Question 18. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option B, metabolic acidosis. Tachycardia and peripheral vasoconstriction are early compensatory mechanisms to maintain cardiac output. In this rotation, B is the correct position. Question 19. A patient with chest pain has elevated troponin but a normal ECG. This is consistent with: Option A, STEMI. Option B, non-STEMI, NSTEMI. Option C, unstable angina. Option D, stable angina. The correct answer is option C, unstable angina. Elevated troponin with ischemic symptoms without ST elevation defines NSTEMI. In this rotation, C is the correct position. Question 20. A patient with a hyphema should be positioned: Option A, flat with the affected eye down. Option B, with the head of bed elevated 30 to 45 degrees. Option C, prone. Option D, in Trendelenburg. The correct answer is option B, with the head of bed elevated 30 to 45 degrees. Head elevation helps settle blood in the anterior chamber and reduce rebleeding risk. Question 21. Which statement by a patient receiving nitroglycerin indicates a need for further teaching? Option A, I will sit or lie down when I take it. Option B, I can take up to 3 doses 5 minutes apart. Option C, I should call 911 if pain is not relieved after 1 dose. Option D, I can take it with sildenafil if needed. The correct answer is option A, I will sit or lie down when I take it. Nitrates combined with PDE5 inhibitors can cause life-threatening hypotension. In this rotation, A is the correct position. Question 22. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Elevated serum creatinine and BUN are the hallmark lab findings of acute kidney injury. Question 23. Which of the following is the most reliable indicator of adequate fluid resuscitation in shock? Option A, urine output of 0.5 ml/kg/hr or more. Option B, heart rate below 100. Option C, blood pressure above 120/80. Option D, central venous pressure above 15. The correct answer is option A, urine output of 0.5 ml/kg/hr or more. Adequate urine output indicates improved renal perfusion and is a good indicator of fluid resuscitation adequacy. Question 24. A patient with a black widow spider bite presents with Option A, localized tissue necrosis. Option B, severe muscle cramps, abdominal rigidity, and hypertension. Option C, hemorrhage. Option D, ascending paralysis. The correct answer is option B, severe muscle cramps, abdominal rigidity, and hypertension. Black widow venom, letrotoxin, causes neurotransmitter release, leading to severe muscle cramps and autonomic instability. Question 25. A patient with a transfusion-related acute lung injury, TRLI, presents with Option A, fever and rash. Option B, acute dyspnea, hypoxemia, and bilateral pulmonary edema within 6 hours of transfusion. Option C, hypertension. Option D, anaphylaxis. The correct answer is option A, fever and rash. TRLI is characterized by acute respiratory distress and non-cardiogenic pulmonary edema after transfusion. In this rotation, A is the correct position. Question 26. A patient with a chest tube to water seal has continuous bubbling in the water seal chamber. This indicates Option A, normal chest tube function. Option B, a persistent air leak in the system or patient's lung. Option C, the lung has fully re-expanded. Option D, the suction is too high. The correct answer is option D, the suction is too high. Continuous bubbling in the water seal chamber indicates an air leak. Intermittent bubbling during exhalation or coughing is normal. In this rotation, D is the correct position. Question 27. A patient presents with hematochezia, bright red blood per rectum. This indicates Option A, upper GI bleeding only. Option B, lower GI bleeding or rapid upper GI bleeding. Option C, always hemorrhoids. Option D, chronic slow GI bleeding. The correct answer is option A, upper GI bleeding only. Hematochezia usually indicates lower GI bleeding, but can occur with massive, rapid upper GI bleeding. In this rotation, A is the correct position. Question 28. The typical presentation of autonomic dysreflexia includes Option A, severe hypotension and bradycardia. Option B, severe hypertension, pounding headache, and diaphoresis above the injury level. Option C, fever and muscle spasms. Option D, decreased level of consciousness. The correct answer is option B, severe hypertension, pounding headache, and diaphoresis above the injury level. Autonomic dysreflexia causes severe hypertension, headache, flushing, and diaphoresis above the level of injury. Question 29. A patient is receiving a blood transfusion and develops chills, fever, and flank pain. The nurse suspects. Option A, mild allergic reaction. Option B, acute hemolytic transfusion reaction. Option C, fluid overload. Option D, normal response to transfusion. The correct answer is option C, fluid overload. Acute hemolytic reaction presents with fever, chills, flank pain, hemoglobinuria, and hypotension. In this rotation, C is the correct position. Question 30. Calcium should not be administered for hyperkalemia in a patient with Option A, renal failure. Option B, digoxin toxicity, risk of stone heart. Option C, DKA. Option D, rhabdomyolysis. The correct answer is option B, digoxin toxicity, risk of stone heart. Calcium administration in digoxin toxicity can cause irreversible cardiac contracture, stone heart. Question 31. A patient with a gunshot wound to the chest has an open pneumothorax. The initial management includes Option A, 3-sided occlusive dressing. Option B, immediate intubation. Option C, needle decompression immediately. Option D, chest tube insertion as the only intervention. The correct answer is option B, immediate intubation. An open pneumothorax should be covered with a 3-sided occlusive dressing to prevent tension pneumothorax. Question 32. A patient with a retinal detachment describes the vision loss as Option A, gradual blurring. Option B, a curtain coming down over the vision. Option C, central vision loss only. Option D, complete bilateral blindness. The correct answer is option A, gradual blurring. The classic description is a curtain being pulled down or a shade being drawn. In this rotation, A is the correct position. Question 33. The nurse is assessing a patient with a possible stroke. Which finding suggests a right hemispheric stroke? Option A, aphasia. Option B, left-sided neglect and visual spatial deficits. Option C, right-sided weakness. Option D, language difficulties. The correct answer is option D, language difficulties. Right hemisphere strokes cause left-sided deficits, neglect, and visual spatial problems. In this rotation, D is the correct position. Question 34. The most critical treatment for a patient with heat stroke is Option A, oral rehydration with electrolyte solution. Option B, rapid cooling to a core temperature below 39 degrees Celsius, 102 degrees Fahrenheit. Option C, administration of antipyretics. Option D, active external rearming. The correct answer is option D, active external rearming. Heat stroke requires immediate, aggressive cooling. Antipyretics are not effective. In this rotation, D is the correct position. Question 35. The most common initial symptom of multiple sclerosis is Option A, seizures. Option B, optic neuritis, vision changes, eye pain. Option C, renal failure. Option D, cardiac dysrhythmia. The correct answer is option C, renal failure. Optic neuritis and sensory disturbances are common initial presentations of MS. In this rotation, C is the correct position. Question 36. A patient with a traumatic brain injury has a CPP of 50 mmHg. The nurse should Option A, continue to monitor as this is normal. Option B, notify the provider immediately as this indicates inadequate cerebral perfusion. Option C, administer antihypertensive medication. Option D, increase sedation. The correct answer is option C, Administer antihypertensive medication. CPP should be maintained at 60 to 80 mmHg. CPP below 60 indicates inadequate perfusion. In this rotation, C is the correct position. Question 37. The appropriate aspirin dose for suspected ACS is: Option A 162 to 325 mg chewable, non-enteric coated. Option B 81 mg chewable. Option C 650 mg enteric coated. Option D 1000 mg rectal. The correct answer is option A. 162 to 325 mg chewable, non-enteric coated. 162 to 325 mg of non-enteric coated, chewable aspirin should be given as soon as possible. Question 38. A patient with chest pain has ST depression in leads V5, V6 and lead I. This suggests: Option A inferior ischemia. Option B anterior ischemia. Option C lateral ischemia. Option D septal ischemia. The correct answer is option C. Lateral ischemia. ST changes in V5, V6 and lead I reflect the lateral wall of the left ventricle. Question 39. Murphy's sign is used to assess for: Option A acute pancreatitis. Option B acute cholecystitis. Option C diverticulitis. Option D small bowel obstruction. The correct answer is option B. Acute cholecystitis. Murphy's sign, pain and inspiratory arrest during palpation of the right upper quadrant, suggests acute cholecystitis. Question 40. Which potassium level is most concerning and requires immediate intervention? Option A 3.5 milliequivalent/L. Option B 6.8 milliequivalent/L with ECG changes. Option C 4.0 milliequivalent/L. Option D 5.0 milliequivalent/L. The correct answer is option A. 3.5 milliequivalent/L. Severe hyperkalemia with ECG changes is a life-threatening emergency requiring immediate treatment. In this rotation, A is the correct position. Question 41. The gold standard for diagnosing pulmonary embolism is: Option A D-dimer assay. Option B chest X-ray. Option C CT pulmonary angiography. Option D ventilation perfusion scan. The correct answer is option A. D-dimer assay. CT pulmonary angiography is the gold standard for PE diagnosis. In this rotation, A is the correct position. Question 42. A patient with a penetrating eye injury should be positioned: Option A flat with the affected eye down. Option B with the head of bed elevated and both eyes patched if ordered. Option C lying on the affected side. Option D in Trendelenburg. The correct answer is option C. Lying on the affected side. Head elevation reduces intraocular pressure. Both eyes may be patched to reduce eye movement. In this rotation, C is the correct position. Question 43. The most common site of infection causing sepsis is: Option A urinary tract. Option B respiratory tract. Option C intra-abdominal. Option D skin/soft tissue. The correct answer is option B. Respiratory tract. Pneumonia and respiratory tract infections are the most common sources of sepsis. Question 44. A patient with an inferior wall MI develops RV infarction. Which finding would the nurse expect? Option A pulmonary edema. Option B, hypotension responsive to fluids. Option C, hypertension. Option D, crackles in all lung fields. The correct answer is option B, hypotension responsive to fluids. RV infarction presents with hypotension, elevated JVP, and clear lung fields. Treatment includes fluid administration. Question 45. A patient receiving magnesium sulfate develops respiratory depression and absent patellar reflexes. The nurse should: Option A, continue the infusion and monitor. Option B, stop the infusion and administer calcium gluconate. Option C, increase the infusion rate. Option D, administer naloxone. The correct answer is option B, stop the infusion and administer calcium gluconate. Loss of reflexes and respiratory depression indicate magnesium toxicity. Calcium gluconate is the antidote. Question 46. The nurse anticipates which loading dose in addition to aspirin for STEMI going to PCI? Option A, warfarin 5 mg. Option B, ticagrelor 180 mg or clopidogrel 600 mg. Option C, heparin 5000 units. Option D, alteplase bolus. The correct answer is option B, ticagrelor 180 mg or clopidogrel 600 mg. A P2Y12 inhibitor loading dose along with aspirin is standard dual antiplatelet therapy for PCI. Question 47. A patient with esophageal perforation, Barr-Have syndrome, classically presents with: Option A, gradual onset of dysphagia. Option B, severe chest pain and subcutaneous emphysema after forceful vomiting. Option C, chronic heartburn. Option D, painless hematemesis. The correct answer is option B, severe chest pain and subcutaneous emphysema after forceful vomiting. Barr-Have syndrome is spontaneous esophageal rupture from forceful vomiting, causing severe chest pain and subcutaneous emphysema. Question 48. A patient with anaphylaxis has received epinephrine and antihistamines but has persistent wheezing. The next intervention is: Option A, more epinephrine. Option B, albuterol nebulizer. Option C, intubation. Option D, observation. The correct answer is option B, albuterol nebulizer. Albuterol treats bronchospasm. Epinephrine is systemic, albuterol provides local bronchodilation. Question 49. The nurse is caring for a patient post-ictal after a seizure. The patient is confused but has a patent airway. The nurse should: Option A, restrain the patient. Option B, place the patient in a side-lying position and allow to rest. Option C, administer more anticonvulsants immediately. Option D, insert an oral airway. The correct answer is option B, place the patient in a side-lying position and allow to rest. Post-ictal patients need airway protection, side-lying, and a safe environment. They should not be restrained. Question 50. A patient with anticholinergic toxicity presents with: Option A, salivation, lacrimation, urination. Option B, dry skin, flushed appearance, mydriasis, tachycardia, and altered mental status. Option C, pinpoint pupils and respiratory depression. Option D, muscle rigidity and hyperreflexia. The correct answer is option A, salivation, lacrimation, urination. Anticholinergic toxidrome: hot as a hare, blind as a bat, dry as a bone, red as a beet, mad as a hatter. In this rotation, A is the correct position. Question 51. The drug of choice for rate control and stable AF with RVR without heart failure is: Option A, adenosine. Option B diltiazem or metoprolol. Option C amiodarone. Option D procainamide. The correct answer is option C, amiodarone. Beta blockers or calcium channel blockers are first line. In this rotation, C is the correct position. Question 52. Which of the following is a common cause of a subdural hematoma? Option A laceration of the middle meningeal artery. Option B tearing of bridging veins between the dura and brain surface. Option C rupture of a cerebral aneurysm. Option D fracture of the temporal bone. The correct answer is option C, rupture of a cerebral aneurysm. Subdural hematomas are usually caused by tearing of bridging veins. In this rotation, C is the correct position. Question 53. The most effective cooling method for exertional heat stroke is Option A antipyretics. Option B ice water immersion. Option C evaporative cooling with tepid water. Option D cooling blankets only. The correct answer is option A, antipyretics. Ice water immersion provides the most rapid cooling rate for exertional heat stroke. In this rotation, A is the correct position. Question 54. Which medication is a priority intervention for acute pulmonary edema with a BP of 180/100 mmHg? Option A dopamine infusion. Option B 4-furosemide and nitroglycerin. Option C oral metoprolol. Option D 4 normal saline bolus. The correct answer is option C, oral metoprolol. Aggressive afterload reduction and diuresis are priorities. In this rotation, C is the correct position. Question 55. The first-line treatment for a patient with a kidney stone and suspected infection is Option A oral antibiotics and discharge. Option B 4 antibiotics, urgent urology consultation, and possible decompression. Option C increased fluid intake only. Option D watchful waiting. The correct answer is option D, watchful waiting. An obstructing stone with infection is a urologic emergency requiring urgent decompression and 4 antibiotics. In this rotation, D is the correct position. Question 56. A patient with pneumonia has purulent sputum, fever, and a WBC count of 18,000. These findings indicate Option A viral pneumonia. Option B allergic reaction. Option C bacterial pneumonia with systemic inflammatory response. Option D pulmonary edema. The correct answer is option D, pulmonary edema. Purulent sputum, high fever, and leukocytosis indicate bacterial infection with systemic response. In this rotation, D is the correct position. Question 57. Which of the following is a classic finding in diabetic ketoacidosis, DKA? Option A hypoglycemia and metabolic alkalosis. Option B hyperglycemia, anion gap metabolic acidosis, and ketonuria. Option C hyperglycemia without ketones. Option D hypoglycemia with ketones. The correct answer is option B, hyperglycemia, anion gap metabolic acidosis, and ketonuria. DKA is characterized by hyperglycemia, ketosis, and high anion gap metabolic acidosis. Question 58. The treatment for severe hypermagnesemia includes Option A magnesium supplements. Option B 4 calcium gluconate and supportive care. Option C oral phosphate binders. Option D thiazide diuretics. The correct answer is option A, magnesium supplements. 4. Calcium antagonizes the effects of magnesium. Hemodialysis may be needed for severe cases. In this rotation, A is the correct position. Question 59. The most common cause of acute pancreatitis is: Option A, gallstones and chronic alcohol use. Option B, hypertriglyceridemia. Option C, medications. Option D, trauma. The correct answer is option D, trauma. Gallstones and alcohol account for the majority of acute pancreatitis cases. In this rotation, D is the correct position. Question 60. A patient with acute pancreatitis has Gray Turner's sign. The nurse observes: Option A, periumbilical ecchymosis. Option B, flank ecchymosis. Option C, jaundice. Option D, abdominal distension. The correct answer is option D, abdominal distension. Gray Turner's sign is ecchymosis of the flanks, indicating retroperitoneal hemorrhage. In this rotation, D is the correct position. Question 61. Which ventilator mode delivers a set tidal volume but allows the patient to breathe spontaneously between mandatory breaths? Option A, assist control, AC. Option B, synchronized intermittent mandatory ventilation, SIMV. Option C, pressure support ventilation, PSV. Option D, continuous positive airway pressure, CPAP. The correct answer is option C, pressure support ventilation, PSV. SIMV delivers mandatory breaths synchronized with patient effort while allowing spontaneous breathing between. In this rotation, C is the correct position. Question 62. The most common cause of subarachnoid hemorrhage is: Option A, arteriovenous malformation rupture. Option B, trauma. Option C, aneurysm rupture. Option D, hypertension. The correct answer is option D, hypertension. Ruptured cerebral aneurysm is the most common cause of non-traumatic SAH. In this rotation, D is the correct position. Question 63. The preferred medication for rate control in AF with RVR in a patient with heart failure with reduced ejection fraction is: Option A, diltiazem. Option B, verapamil. Option C, digoxin. Option D, metoprolol. The correct answer is option C, digoxin. Digoxin can be used for rate control in AF, particularly in patients with heart failure. Non-dihydropyridine calcium channel blockers are typically avoided in HFrEF. Question 64. The antidote for cyanide poisoning is: Option A, naloxone. Option B, hydroxycobalamin, cyanoacate, or sodium thiosulfate. Option C, atropine. Option D, N-acetylcysteine. The correct answer is option D, N-acetylcysteine. Hydroxycobalamin binds cyanide directly. Sodium thiosulfate enhances endogenous detoxification. In this rotation, D is the correct position. Question 65. A patient with septic shock who is started on norepinephrine should have a target mean arterial pressure, MAP, of: Option A, at least 55 mmHg. Option B, at least 65 mmHg. Option C, at least 85 mmHg. Option D, at least 100 mmHg. The correct answer is option C, at least 85 mmHg. Current guidelines recommend an initial MAP target of 65 mmHg in septic shock. In this rotation, C is the correct position. Question 66. A patient with atrial fibrillation not on anticoagulation presents with acute onset right leg pain, pallor, and absent pulses. The nurse suspects. Option A, acute deep vein thrombosis. Option B, acute arterial occlusion from embolism. Option C, severe cellulitis. Option D, compartment syndrome. The correct answer is option B. Acute arterial occlusion from embolism. The sudden onset of the 6PS in a patient with AF suggests an embolic arterial occlusion from a cardiac thrombus. Question 67. The most effective measure to prevent ventilator-associated pneumonia, VAP, is Option A, prophylactic antibiotics. Option B, daily sedation interruption. Option C, elevating the head of bed 30 to 45 degrees. Option D, frequent ventilator circuit changes. The correct answer is option C. Elevating the head of bed 30 to 45 degrees. Head of bed elevation to 30 to 45 degrees is one of the most effective and evidence-based VAP prevention measures. Question 68. The classic triad of symptoms for acute appendicitis is Option A, fever, vomiting, diarrhea. Option B, periumbilical pain migrating to RLQ, anorexia, nausea/vomiting. Option C, jaundice, dark urine, clay-colored stools. Option D, hematemesis, melena, hypotension. The correct answer is option A. Fever, vomiting, diarrhea. The classic presentation is periumbilical pain that migrates to the RLQ with anorexia and nausea. In this rotation, A is the correct position. Question 69. A patient with a tracheostomy tube has copious thick secretions. The priority nursing intervention is Option A, increase sedation. Option B, frequent suctioning and humidification of inspired air. Option C, remove the tracheostomy tube. Option D, administer antitussives. The correct answer is option B. Frequent suctioning and humidification of inspired air. Adequate humidification and suctioning maintain airway patency and prevent mucus plugging. Question 70. The nurse is assessing a patient with a suspected basilar skull fracture. Which finding is most consistent? Option A, Battle's sign, mastoid ecchymosis. Option B, scalp laceration. Option C, anterior neck hematoma. Option D, depressed skull fracture. The correct answer is option C. Anterior neck hematoma. Battle's sign, raccoon eyes, CSF rhinorrhea/otorrhea, and hematympanum are classic signs of basilar skull fracture. In this rotation, C is the correct position. Question 71. A patient with DKA is being treated with 4 fluids and insulin. The nurse must carefully monitor Option A, liver function tests. Option B, serum potassium levels. Option C, coagulation studies. Option D, cardiac enzymes. The correct answer is option C. Coagulation studies. Potassium shifts during DKA treatment can cause life-threatening hypokalemia or hyperkalemia. In this rotation, C is the correct position. Question 72. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects Option A, cystitis. Option B, pyelonephritis. Option C, nephrolithiasis. Option D, renal artery stenosis. The correct answer is option C. Nephrolithiasis. Pyelonephritis presents with systemic symptoms, fever, chills, and CVA tenderness. In this rotation, C is the correct position. Question 73. The most common cause of anaphylaxis in the emergency department is Option A, insect stings. Option B, medications, antibiotics, NSAIDs. Option C, food allergies. Option D, latex. The correct answer is option C, food allergies. Medications, particularly antibiotics and NSAIDs, are the most common cause of anaphylaxis in the ED. In this rotation, C is the correct position. Question 74. The antidote for iron overdose is Option A, naloxone. Option B, deferoxamine. Option C, N-acetylcysteine. Option D, flumazenol. The correct answer is option B, deferoxamine. Deferoxamine chelates free iron and is indicated for severe iron poisoning. Question 75. A patient with Parkinson's disease is at risk for which complication in the emergency department? Option A, hypertension. Option B, aspiration pneumonia. Option C, hyperglycemia. Option D, deep vein thrombosis only. The correct answer is option D, deep vein thrombosis only. Dysphagia in Parkinson's increases aspiration risk. Aspiration pneumonia is a common cause of ED visits and death. In this rotation, D is the correct position. Question 76. The most common cause of lower gastrointestinal bleeding in adults is Option A, gastric ulcer. Option B, diverticulosis. Option C, esophageal varices. Option D, Mallory-Weiss tear. The correct answer is option C, esophageal varices. Diverticulosis is the most common cause of lower GI bleeding. Upper GI bleeding is most commonly caused by peptic ulcer disease. In this rotation, C is the correct position. Question 77. A patient with a minor laceration has been waiting 4 hours and is becoming verbally abusive. The nurse should Option A, tell the patient to leave. Option B, acknowledge the frustration, explain the triage process, and provide an update. Option C, ignore the patient. Option D, call security immediately. The correct answer is option D, call security immediately. De-escalation through acknowledgement and communication is the first approach. In this rotation, D is the correct position. Question 78. Ovarian torsion presents with Option A, bilateral lower quadrant pain. Option B, sudden, severe unilateral lower abdominal pain with nausea and vomiting. Option C, painless vaginal bleeding. Option D, fever and purulent discharge. The correct answer is option D, fever and purulent discharge. Ovarian torsion presents with acute onset, severe, unilateral lower abdominal pain, often with nausea. In this rotation, D is the correct position. Question 79. Which of the following is a normal PaO2 for a healthy adult breathing room air? Option A, 50 to 60 mmHg. Option B, 60 to 70 mmHg. Option C, 80 to 100 mmHg. Option D, 100 to 120 mmHg. The correct answer is option C, 80 to 100 mmHg. Normal PaO2 on room air is 80 to 100 mmHg. Values below 80 indicate hypoxemia, below 60 indicates severe hypoxemia. Question 80. The initial management of thyroid storm includes Option A, levothyroxine. Option B, beta blockers, antithyroid medications, and supportive care. Option C, radioactive iodine as the first step. Option D, observation only. The correct answer is option A, levothyroxine. Beta blockers, propranolol, thionamides, PTU or methimazole, and supportive care are first line. In this rotation, A is the correct position. Question 81. The most serious complication of acute pancreatitis is: Option A, nausea and vomiting. Option B, hyperglycemia. Option C, acute respiratory distress syndrome, ARDS, and multi-organ failure. Option D, mild abdominal pain. The correct answer is option B, hyperglycemia. ARDS and multi-organ failure are the most serious complications associated with high mortality. In this rotation, B is the correct position. Question 82. The nurse is caring for a patient who is a victim of domestic violence. The priority intervention is: Option A, contact the abuser for their side of the story. Option B, assess and treat injuries, ensure patient safety, and provide resources. Option C, discharge the patient immediately. Option D, advise the patient to go home and work it out. The correct answer is option A. Contact the abuser for their side of the story. Patient safety is the priority. Injuries are treated, safety assessed, and referrals provided. In this rotation, A is the correct position. Question 83. A patient with meningitis has a positive Brudzinski's sign. The nurse observed: Option A, pain with straight leg raise. Option B, involuntary hip flexion when the neck is flexed. Option C, inability to extend the knee with hip flexed. Option D, dorsiflexion of the great toe. The correct answer is option A, pain with straight leg raise. Brudzinski's sign is involuntary flexion of the hips and knees when the neck is passively flexed. In this rotation, A is the correct position. Question 84. A patient with severe flank pain has a positive urine pregnancy test. The nurse's next priority is: Option A, administer pain medication and obtain renal imaging. Option B, discharge with follow-up. Option C, rule out ectopic pregnancy with ultrasound. Option D, administer antibiotics. The correct answer is option B, discharge with follow-up. Ectopic pregnancy must be ruled out first in a pregnant patient with pain, even if symptoms suggest renal colic. In this rotation, B is the correct position. Question 85. Which medication is used to reverse the effects of benzodiazepines in overdose? Option A, naloxone. Option B, flumazenol. Option C, N-acetylcysteine. Option D, atropine. The correct answer is option D, atropine. Flumazenol is a benzodiazepine antagonist. However, its use is controversial due to seizure risk. In this rotation, D is the correct position. Question 86. A patient presents with a history of ingesting a large amount of an unknown substance. The ECG shows a widened QRS complex. The nurse suspects: Option A, acetaminophen toxicity. Option B, tricyclic antidepressant overdose. Option C, benzodiazepine overdose. Option D, opioid overdose. The correct answer is option C, benzodiazepine overdose. TCA overdose causes sodium channel blockade, leading to QRS widening, greater than 100 ms, seizures, and hypotension. In this rotation, C is the correct position. Question 87. A patient in the ED suddenly develops pulseless ventricular tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, synchronized cardioversion at 100 J. Option C, immediate high-quality CPR and defibrillation. Option D, transcutaneous pacing. The correct answer is option D, transcutaneous pacing. Pulseless VT is a shockable rhythm treated with immediate CPR and defibrillation. In this rotation, D is the correct position. Question 88. A patient with a subarachnoid hemorrhage is at highest risk for vasospasm during which time period? Option A, first 24 hours. Option B, days 4 to 14 after hemorrhage. Option C, after 1 month. Option D, first hour only. The correct answer is option B, days 4 to 14 after hemorrhage. Cerebral vasospasm typically occurs between days 4 and 14 after SAH, causing delayed cerebral ischemia. Question 89. The first-line treatment for life-threatening hyperkalemia with ECG changes is: Option A, oral potassium binders. Option B, 4-calcium gluconate or calcium chloride. Option C, insulin alone. Option D, sodium bicarbonate alone. The correct answer is option A, oral potassium binders. 4-calcium stabilizes the cardiac membrane and prevents dysrhythmias. It is the first priority in life-threatening hyperkalemia. In this rotation, A is the correct position. Question 90. A patient presents to the ED with a laceration requiring sutures. During the procedure, the patient states they feel faint. The nurse's first action is: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The procedure should be stopped immediately to reduce vagal stimulation and prevent syncope. Then the patient can be placed supine and assessed. Question 91. A patient with acute pancreatitis develops hypocalcemia. This occurs due to: Option A, increased calcium absorption. Option B, saponification of calcium by free fatty acids in the retroperitoneum. Option C, decreased parathyroid hormone. Option D, increased renal calcium excretion. The correct answer is option C, decreased parathyroid hormone. Free fatty acids bind calcium, saponification, in areas of fat necrosis, causing hypocalcemia. In this rotation, C is the correct position. Question 92. A patient with increased ICP is hyperventilated to a PaCO2 of 30 mmHg. The purpose is: Option A, to increase cerebral blood flow. Option B, to cause cerebral vasoconstriction and decrease ICP. Option C, to improve oxygenation. Option D, to decrease cardiac output. The correct answer is option B, to cause cerebral vasoconstriction and decrease ICP. Hyperventilation causes vasoconstriction of cerebral vessels, decreasing cerebral blood volume and ICP. This is a temporizing measure. Question 93. Which physical finding is most consistent with acute appendicitis? Option A, right upper quadrant pain. Option B, rebound tenderness at McBurney's point. Option C, left lower quadrant pain. Option D, epigastric pain radiating to the back. The correct answer is option B, rebound tenderness at McBurney's point. McBurney's point, RLQ, tenderness with rebound is the classic finding in acute appendicitis. Question 94. Which ECG finding is most characteristic of severe hyperkalemia? Option A, peaked T waves and widened QRS. Option B, prolonged QT interval. Option C, ST depression. Option D, U waves. The correct answer is option D, U waves. Severe hyperkalemia causes peak T waves, loss of P waves, widened QRS, and ultimately sine wave pattern. In this rotation, D is the correct position. Question 95. A patient with ethylene glycol, antifreeze, poisoning has Option A, normal anion gap acidosis. Option B, high anion gap metabolic acidosis with calcium oxalate crystals in urine. Option C, respiratory alkalosis. Option D, hypoglycemia. The correct answer is option C, respiratory alkalosis. Ethylene glycol causes high anion gap acidosis, oxalate crystalluria, and end organ damage. In this rotation, C is the correct position. Question 96. The nurse is caring for a patient post-TPA for ischemic stroke. The BP suddenly rises to 210/120. The nurse should Option A, administer labetalol as ordered and stop TPA if still infusing. Option B, continue monitoring without intervention. Option C, administer more TPA. Option D, administer hydralazine. The correct answer is option A, administer labetalol as ordered and stop TPA if still infusing. Severe hypertension during/after TPA increases hemorrhage risk. It must be aggressively managed. Question 97. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen with 4 contrast. Option D, complete blood count. The correct answer is option A, abdominal X-ray. CT scan is the most accurate imaging modality for appendicitis, though ultrasound is often initial in children and pregnant patients. In this rotation, A is the correct position. Question 98. A patient with hyperglycemic hyperosmolar state, HHS, typically requires Option A, aggressive 4 fluids and insulin therapy. Option B, observation only. Option C, oral hypoglycemics only. Option D, glucagon. The correct answer is option D, glucagon. HHS requires aggressive fluid resuscitation and insulin therapy, similar to but distinct from DKA management. In this rotation, D is the correct position. Question 99. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive 4 fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option A, encourage early ambulation. Initial management includes bowel rest, NPO, and aggressive 4 fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. In this rotation, A is the correct position. Question 100. A patient with a brown recluse spider bite may develop Option A, neurotoxicity. Option B, local tissue necrosis, hemolysis, and systemic symptoms. Option C, severe muscle cramps. Option D, ascending paralysis. The correct answer is option D, ascending paralysis. Brown recluse venom causes local necrosis, and in severe cases, systemic loxoscelism with hemolysis and DIC. In this rotation, D is the correct position.